Would you know what to do if you were deep in the wilderness and a hunting companion sustained a penetrating chest wound from an errant round? Could you prolong the life of a loved one long enough for an ambulance to arrive if he or she had sustained a lacerated artery from a violent attacker armed with a knife? Are you confident enough to take charge of a scene and bridge the gap between the start of an emergency and the arrival of EMS for a patient suffering from cardiac arrest or a fractured femur or an anaphylactic reaction or a diabetic emergency? While most Americans are comfortable dealing with the cuts and scrapes of everyday life, and though tens of thousands have learned the Heimlich maneuver and CPR, most individuals would be considerably less comfortable dealing with severe, life-threatening injuries or illnesses when seconds count and EMS in the emergency room are minutes or longer away. The goal of this course is to help you gain the knowledge, confidence, and competence needed to deal with dozens of medical and traumatic emergencies, including each of those mentioned. That will include knowing what to do if you are ever confronted with a loved one falling victim to cardiac arrest or any number of other significant life threats. The interventions, tools, and skills you'll learn in this course are similar to those that professionals use. You'll also have the same goal as the professionals: deliver the patient as quickly and as safely as possible to an emergency room while attempting to stabilize or improve his or her condition. Excluding urban areas and suburban areas, millions of U.S. citizens are outside the golden hour of EMS arrival. And if you've embarked on a camping, hiking, or canoe trip, you might find yourself literally days from EMS support and the entrance to an emergency room. That might mean that as a non-professional, you'll need to conduct a few tasks that even the men and women in the back of the ambulance don't do on a regular basis. It all starts with a good scene and patient assessment. That's Lesson 1. We begin with an explanation of how to conduct a patient and scene assessment, including a primary assessment, an assessment of the patient's ABCs, and a rapid secondary trauma assessment. Lesson 2 focuses entirely on the traumatic emergencies, including severe bleeding, severe lacerations, penetrating injuries to the torso, severe burns, musculoskeletal trauma, femur fractures and pelvic fractures, simple and complex rib fractures, head trauma, and trauma to the eye. And we'll close this lesson with a virtual exercise on how to conduct a triage. Lesson 3 covers medical emergencies, including myocardial infarctions, heart attacks, cardiac arrest, diabetic emergencies, stroke, seizures and syncope, anaphylaxis, venomous snake bites, hypothermia, heat stroke, airway obstructions, shock, and drug overdose. Lesson 4 will summarize the course with everything you should know when it comes to building your own small, medium, or large emergency first aid kit for a variety of conditions. If you're interested, we have a class coming up on March 1st, 2025, and it's a full-day class from 9 a.m. to 5 p.m. Contact us at any of the methods on the screen, or click on the registration link below in the description to register directly. If you have any questions, we'd love to hear from you. Thank you from Intrepid Firearms Academy.